MDR Annex 8 provides 22 rules to help you put your device in the correct class, but you don't always have to go through all of them because they are put in 4 sections depending on what subgroup of devices they are about. In this video, we briefly treat the first 3. In order to know which classification rules to look at for your medical device, first ask for each subgroup, is it? So check your device and the definitions in MDR Annex 8 chapters 1 and 2 and then first decide, is your device intended by you, the manufacturer, to be used non-invasively or invasively? As these are mutually exclusive, you only need to check one of these groups. But because for both non-invasive and invasive use there can be active devices, you must always check Section 5 as well and decide whether or not your device is an active device. Now, to some extent, these rules are quite self-explanatory, especially when you also keep the definitions in chapters 1 and 2 and the guidance documents at hand. But to help you getting used to this labyrinth of rules, let's classify a much-used device together. If you can, keep Annex 8 at hand as a printed copy or in a different window that you can easily switch to. Now let's classify a stapler. No, not that one. This one. A disposable surgical stapler. It is used to quickly and easily close incisions or connect pieces of tissue during surgery without having to suture with needle and thread. A spring in the stapler is squeezed to load the device and then the energy in the spring is released to forcefully press a staple or a whole row of them through the tissue layers and close it. Just like the ones used in construction work, but smaller. Now, is it a non-invasive device or is it an invasive device? Well, it is put into the body of the patient, so it's definitely invasive. Now let's dive into Section 5. The first rule in there is Rule 5, which starts with all invasive devices with respect to body orifices, other than surgical invasive devices, etc. If you read this rule, you'll see it's entirely about devices entering body orifices, but that do not breach the boundaries of these. And body orifices were defined as any natural opening of the body, the external surface of the eyeball, or any permanent artificial opening, such as a stoma. So, Rule 5 does not apply. Next, Rule 6 states, all surgically invasive devices intended for transient use are classified as Class 2A, unless they, and then some exceptions. But let's focus on 2 important aspects first. Surgically invasive is defined in Annex 8, Article 2.2 as an invasive device which penetrates inside the body through the body surface. Also, if that surface is in a body orifice. And that's exactly what is done with the stapler for its actual use. The next relevant term in the definition is about the duration of contact with the tissue. Transient use is defined by Chapter 1 as intended for continuous use for less than 60 minutes. According to the guidance documents, this duration is excluding intermittent breaks. So even if it's used according to the intended use for only 5 minutes per stapling action, but 20 staples are put in place intermittently, the duration would still be 100 minutes. However, in this case, for our device, the intended cumulative use duration is below an hour, which is indeed transient use. So Rule 6 does apply to our stapler. Now let's check the specifics. Now, all surgically invasive devices for transient use are a 2A device with some exceptions. If meant for the heart or central nervous system, it's a Class 3. That's not the case. If the device is reusable, it is a Class 1, but our stapler is disposable. If the device is intended to apply ionizing radiation or medicine in some hazardous manner, it's a Class 2B. But our stapler only delivers stainless steel staples. Now, if the device must cause some biological effect or dissolve in the body, it is again Class 2B. But that's not the case. The stapler will be taken out of the patient and the staples will stay. So, according to Section 5, Rule 6, our device is Class 2A. Now let's continue to check the rest of section 5. Rule 7 is about devices for short-term use, so that rule doesn't apply. Rule 8 is about long-term implanted devices. That doesn't apply to the stapler either, or at least, well, we hope the doctor doesn't forget to take out the device at the end of the surgery. Now we are done checking sections 4 and 5, and it seems our device is class 2A, but we still have to check section 6. Our stapler is a therapeutic device as used for treatment, and according to the definition in MDR Chapter 1, Article 2.4, it is an active device. That's because the stapler is loaded by tensioning a spring, and when stapling, the energy stored in the spring is used to forcefully apply a staple. So there's a conversion of energy, twice. Now let's check the rules in section 6 and start with rule 9. This is about devices that administer or exchange energy to the body or control other active devices, which our stapler does not. Now, Rule 10 is about devices for diagnosis, monitoring, and radiology. Also not applicable. Rule 11 is about software, not applicable. And Rule 12 is about active devices that administer medicine, body liquids, or other substances, which our stapler also doesn't. So that leaves us with the last rule of Section 6, Rule 13. And this says that if none of the other rules in Section 6 apply, the active device is a Class 1. Check. Now we have two rules that say different things, right? Rule 6 says our stapler is Class 2A because of its invasiveness, but Rule 13 says it's Class 1 because of its limited risk type of active properties. So what rules should we follow? Do we take the lowest class because that's easier to comply with, or do we take the highest class, which is harder to comply with and hence more expensive? Luckily, the MDR already has the answer. Whenever a device is intended to be used in several different parts of the body, or if several different rules apply, the class of the device is defined by the rule that results in the higher classification. So in our stapler's case, that means Rule 6 prevails over Rule 13, and we should classify our stapler as Class 2A. So that's how we found the correct class our stapler belongs in. And with the approach that we just went through and the documents we used for it, you can now properly classify most medical devices too.